Summer is around the corner, and there's a lot of stuff that we need to think about, obviously, and I could probably give a couple of days of lectures on all that stuff, but except for me, I doubt it will be interesting and exciting for everybody else. It's just something, obviously, dermatology I love. So, what do we do in the summer? Obviously, we look forward to going on vacations to the beach. Well, looks like a gorgeous beach off the Philippines. Nice, beautiful green color, you know, secluded. Not if you're getting a rash like that. And this rash is called sea bather's eruption. So you can see the rash is located under where the bathing suit is. And I see it very commonly if you, look at some of the islands we like to go. For example, the Beach Boys like to sing, "Take me to Bermuda, Bahama, Pretty Mama." Well, she's not Pretty Mama right in here when she gets all those bumps on her body. Because there are some areas, especially next to the Gulf, also Hawaii, where there is a lot of the circaria, the lava of certain jellyfish and other organisms that are in the ocean, and they get trapped under the bathing suit, and they release their toxin when they are dried out. Or if you wash with regular water, with non-salty water, it causes osmotic pressure, and they have like a harpoon that is inside out, and when you increase their shape, it suddenly balloons and shoots out and gets into the skin, releasing that toxin, which is where you have the jellyfish bites as well. Now this is obviously an area, it looks like it's not very sunny, it's cloudy, but don't forget, even on the cloudy days, you have to use the sun protection. And if you don't use it, you know, this cute little baby, I mean, it's miserable, it's not fun, so it's very important not to forget. They run around all the time and you're busy watching, make sure they don't drown. You need to make sure you also protect them from the sun, use sunblock. Now, they ask what kind of sun protection to use. The one that I personally like to use, and any sun protection is good. Obviously, you have to also not only use sunblock, but also use proper clothing. But if you look at all the studies, one would imagine if you sit under the umbrella, it will be as effective or more effective even than if you put a sunscreen. And the answer is no. Actually, they proved that if you wear sunblock, it's more effective than if you are sitting in a tent, in a shade. Under the umbrella, that is. And obviously, they show you all those beautiful pictures of the women, in the bathing suit. What they don't show you is their backs afterwards, if they're not protecting themselves. So obviously, it's not the same person. But you don't want to get a sunburn like that. Now, the other thing that you need to think about is jellyfish. Now, do you know what is the most poisonous animal in the world?
Jellyfish from Australia.
That's right. Good, 5 points. Jellyfish from Australia. It's called the box jellyfish from Australia. And if you watch the movie 7 Pounds with the rapper and the singer, actor, what's his name? Come in. Well, if you watch that, you saw that he developed, he was putting it on himself because he wanted to give a transplant of his heart to someone that he loved. And it really arrests your heart in 1.5 minutes to 4 minutes. Okay. And this is a doctor, I'm going to show you a picture, who actually makes a living out of collecting those jellyfish. So he goes, grabs them just like you see, this is the box jellyfish there. He grabs it from the top and then he cuts the tentacles. The idea is they want to use that poison in order to make medications from it. Well, a little bit of that tentacle, I mean, one jellyfish can kill 15 people. 60. Well, it depends, but 15 people it can kill, within minutes. And this is, in the emergency room, pain is excruciating. Excruciating pain. He described it as a pain that, imagine taking a knife and cutting yourself across with a hot knife and multiplying it by 20 and making it feel like it lasts forever. That's how
He survived?
He survived, yes. He survived, yeah. So it depends on the level, but one person sorry about the light in the face. One person a year in Australia dies from jellyfish bites. So, sea bather eruptions, where do you get it? Well, you get it in tropics, you can get it in Florida, Hawaii, the Gulf Stream, Bermuda, Bahamas, Thailand, Philippines. The reaction is due to the immature nematocytes from jellyfish and other cercaria. The symptoms that you get, it's itchy, and usually it's after you take a freshwater shower. What happens is they release their toxins, as I said, and they concentrate around hair areas or under the bathing suit where they get trapped. So the way it looks, it will be either papules, 1 millimeter to 1.5 centimeter plaques, yes, so important, if you do decide to go swimming in the sea, it's important that either you don't wear a bathing suit, or you make sure that you take off your bathing suit and shower with the water and soap right after that, so you don't keep it on yourself and dry yourself up with it. Sometimes you actually will feel the itch a little bit, and what we give is we can prescribe some topical steroids, it will go away, but it may last from a few days to up to 2 weeks after. So you decided you don't want to go to the sea. It's too much sun, too much sea bathers eruption, you get upset, you decide, let me go to France. And in France, it looks gorgeous. This is Lake Annecy in France. And you can see there is a gentleman here, he's practicing for his triathlon, he's swimming over there, and he's swimming with a swimsuit. And you wonder, why is he swimming with a swimsuit? You know, what is he trying to avoid? Well, he's trying to avoid swimmer's itch. So swimmer's itch is something that you get in freshwater lakes, and this looks basically like that, and you can see it more on the legs because it's usually found on the edges of the freshwater lakes. This is like big nodular bites, and it's also, it looks different, so it usually doesn't get under the bathing suit. It's more in areas where you don't have the protection from the bathing suit. You understand everything? Any questions so far? If you have any questions, just interrupt. Yes, just ask if you have.
Taking care of your skin is coming after this, right? Taking care of your skin is coming to a patient.
Yes, we did some stuff, but if you have questions, we can also interrupt and ask about that as well. It's just for the summer, taking care of it for the summer, and there will be afterwards further talks as part of the series. So why does this happen? So if you look over here, I don't know if it's big enough, but you have the parasite, which is schistosoma parasite. It lives in the snail, and the snails are usually releasing and found next to the water around early morning and during sunny days. So, and the reason more kids get it than adults is because they usually stand where the shallow water is, and that's usually where it's located, those cercaria. The humans are incidental parasite. They usually get in through the feet of the ducks. Some get into their noses when they drink, and then they come out of their feces. They are in those little eggs, and then those eggs go into the snails, and there the male and female have fun, party, have little babies, and those babies come out and bother us and cause us that swim itch. The way to avoid swimmer's itch is to right after you get exposed to it, you wash yourself with soap and water again, rub it hard, and this way you remove all the cercaria, and also try to not be located for a long period of time at the edges of the lake. So if you want to go and swim in the lake, you want to go deeper, and that's where there really not a lot of them are found. And also if you see a lot of fowl, a lot of birds, ducks, then you want to stay away from there. I was kayaking in Seattle and decided to put my arm a little bit into the water as I was kayaking to play around. It was hot, I was sweating, the itch that I had was insane, and then I had that rash, and that was, you know, interesting to me. I was trying to experiment to see what happens. That's the swimmer's itch. So the question that I would have for you is what is the most, you answered what's the most poisonous animal. The question is what is the, you can give it to Lily. Lily can.
No, it's in charge because it will.
Oh, okay. What's the most deadly animal? Anybody? Yasha, you have the answer? Shark. Okay, so we think about sharks, but that's not the most deadly animal. What's the most deadly animal? So the most deadly animal is humans, obviously, because we kill so much and we have the weirdest ways of finding how to kill people. But besides human, the most deadly animal is actually mosquito. And yearly, millions of people die from the mosquito bites. The WHO, the World Health Organization, recorded that 430,000 people die per year as of 2015 just from malaria, from mosquito bites. So I don't know about you guys, but I'm definitely not friends with the mosquitoes. And this is, I don't know who was brave enough to take that picture, if it's real or not. But this is how the mosquito works, and we have a lot to learn from the mosquitoes. I know I do when I inject my anesthesia so people don't feel it. As you can, he probably penetrates our skin about 40 to 60 times before he actually finds the right spot to get the blood, and most of the time we don't feel it. So he's able to numb the area up a little bit with his saliva, but his saliva also causes irritation. And who bites us? Do you know? Is it the males, the females, both?
Female.
Yes, love bites, and females definitely love us and bite us. I mean, sorry, no pun intended. But you can see he's putting his long proboscis, finding that veins and start sucking on it. And he also secretes a little heparin in it so that it won't, so the blood is thinned out and will not be able to clot. And we'll talk about some of the things that attracts him and how to avoid those things. So one of the things that attracts him is actually pregnant women, which is why you want to be careful if you're pregnant and you're going anywhere and you're worried about viruses like Zika virus or other things that it carries. The reason why pregnant women, in my opinion, are more likely to be bitten is because they have an increase in circulation, increase in the heart rate, and it causes more CO2 production, and they do go for the smell of the CO2. So as you can see, they do smell the CO2, and we will talk about how you can avoid it, and one of the most effective ways is using DEET. And the other thing is, interestingly, I wasn't aware of, they know your blood type, so they like type O blood. So type O blood, they like to bite you more. If you have beer or alcohol, they also attack you more when you have alcohol. The reason is alcohol does thin your blood, does open your vessels for basically the same reasons. And when you exercise, also you breathe more CO2, your heart rate goes up, they also like to bite you more. And this tells you how to tell the difference between the different type of mosquitoes. I don't think once we see a mosquito we want to tell the difference, we just want to swat them and kill them. But if you would tell the difference, anybody would guess what you think this one would be, the one on the right corner there. What do you think this mosquito is? Would it be an Anopheles mosquito or Aedes mosquito? So if you look, the butt is up, so it's an Anopheles mosquito. So the Anopheles mosquito is the mosquito we talked about with malaria. So I've been sick with malaria a couple of times when I lived in Africa. Not fun, and I had to get the injections down, the malaria injection. Wasn't fun. But the ones we're worried more here in the United States, although some people do travel here so they come with malaria as well, is more the Aedes mosquito, and that's also causing the Zika virus. So we don't need the pen. Okay. And the reaction is varied. So I've seen just yesterday people coming in with mosquito bites that the doctor wasn't sure what it was, because it didn't look like mosquito bites, it just looked like bruises, and this was actually mosquito bites. So you can have blisters, you can have just bumps, and it depends on your sensitivity to the bite. And this is a map of the locations where you have the Zika virus where it was found, and you can see our area, and the islands there are areas that are increased risk for Zika virus, and they suggest not to go there for a few months afterwards, also to avoid if you did go there before you get pregnant. So, quick, how do you beat the bites? I say you beat the bites with a bat, and you see here there is a cartoon, I don't know if you can see it, but the father and the son are flying together, and the father asks the son, "How's your first flight, son?" And he says, "Feels great, Dad. Everyone was clapping for me." So that's one, and you can see the other one is like two of them laying on the lizaki, resting there in the backyard next to the pond. And the lady tells her husband she thinks you need a bigger citronella candle. And I don't know if you've ever felt that, but I felt like I want the citronella candle around me, like all the way around. But looks like we're gonna need a bigger citronella candle, right? Stanley, and it is like taken away by this huge mosquito. So, how to avoid them? Well, one thing we can do is we can use repellents or something to attract them and trap them. So the most effective repellent that I recommend is to use DEET, and they come anywhere from 10% to 100%, and this is actually something very important for you to use, and how to use it is also important. In the United States, the Pediatric Association said that you can do it for children 2 months of age and older. In Canada, they don't recommend to use it for younger than 6 months of age. It's best to spray it on the clothes as opposed to apply it on the skin, but I apply it on the skin as well. If you do have a cut, it will burn, and it stings, it can cause an irritation, a reaction. In terms of the concentration that you use, if you use if you use 100%, it will last for up to 12 hours. If you use 30%, which is what's recommended, and it's definitely very safe dose to use, then that would last you for about 3 hours. So if you do that, you need to reapply it. There are some mosquitoes that are resistant, kind of you can say like the bacteria has become resistant to certain antibiotics, the same thing, some mosquitoes are resistant to it. The other stuff that's available, the citronella and the eucalyptus oils, they're not really very effective, and they usually bite through it. So some of them combine together with the DEET. You don't want to use sunblock together with the DEET because it increases the penetration of the DEET. So if you do want to apply the sunblock, you want to wait 30 minutes after application of the sunblock before you apply the DEET on you. By the way, the sunblock also, sunscreen, not sunblock, but sunscreen, the chemical, increases the penetration of some of the swimmer's itch, some of the schistosoma, the parasite that causes you the itchy rash that I described earlier. Some plants you can plant also that will help repel it. Basil, lavender, some of those things also help. Mint can help repel mosquitoes, so you can do that as well. So I say hit the mosquitoes where it hurts, basically preventing the children from being born. What I use the Mosquito Dunk. They will stay in water. If you cannot drain that water, you just leave little bagel-shaped stuff, or they have pellets. And the pellets are made of BTI, which is Bacillus thuringiensis israelensis. The only thing I remember is that it's a bacteria, that's Israeli bacteria. I don't know why it came with Israeli bacteria, maybe because it's effective in fighting stuff that we don't want. But this is something very effective, and it's safe, and it does not cause harm to any animals or to humans in the water. So you can throw it around in the grass and everywhere else. And then if you decide that you want or need to do a spray, then you can do the spray with the chrysanthemum best spray, which is natural spray, but it also kills honeybees, so you gotta be careful with that. Anybody with any questions? All right. So the next thing is the 3 L's, and if you're like Yasha, expert in real estate, location. So you gotta make sure you're in the right location. So if you don't want to be bitten by mosquitoes, you need to go to a high elevation. elevation of 2,000 meters or more. If you go up to Mount Everest, you're safe, no mosquitoes there. Or if it's very cold where you're going, there won't be mosquitoes there. The other thing you can do is you can put also some fans. So if you put fans to a speed of, gentle speed. So the mosquitoes is about the female mosquitoes, which we worry about because that's the one that bites, weighs about 2 milligrams. So if you put about a speed of 2 miles an hour of wind, which is just a fan going gently, it will push the mosquitoes away, and they also will not be able to use their olfactory sense, which is what they use to hone in on the pheromones and the CO2 that we excrete. And the other thing is you want to make sure that the vegetation, if you have any logs that are laying there, or you have a grass that's tall, you want to cut it short so that the water will be dried up. It takes about 2 days for the eggs to hatch, and they can stay there all the winter. So it's important that you will put those little pellets of the Bacillus israelensis in advance of their hatching, or even and reapply it every month. How does it look? As I said, it can be bruises, blisters, or just bumps. And the treatment, when I go to certain islands, like when I go to Aruba, I start a day or two before to take antihistamines like Claritin, and then I still get bitten, but I don't feel the bites. So I don't get those big bumps, and I can enjoy myself, except when I see them around me, then I feel like I'm being bitten even though they're not really biting me, or I don't really feel the bites. So that's about it. Any questions?
Doctor, so when you have already mosquito on your skin and he's already inside your skin, what is better to do? Just to blow or just clap?
That's a very smart question. I don't know the answer to that, because if you clap, it will release its toxin. It will most likely release its toxin. If you can swap him off, it will be better than clapping, but most of us end up clapping, and then it releases its toxin even more. Yeah, it's a very good question. I don't know if there's an answer to that, but I'm not aware what is better. Very good question. I think the best is to spray yourself in advance and don't even count. Or long clothes. Now, my dad was in Siberia as part of his work school when he was in the old Soviet Union. And over there he said if you tied, because there were mosquitoes everywhere when the summer came along, it was short summer, but right away all animals come alive, and he said at first they would tie their clothes very tight on their face so they won't be able to get in there, and everywhere where they tied the clothes they would have bites. So it's like a tourniquet. The blood supply will swell up, and they're like, oh, thank you, it's easy for me to find the vein. And they just go all around there, and it's like insanity. You feel like you're on fire.
Wear clothing like that.
No, but longer clothing will help protect your skin. I mean, so if you really hate the mosquitoes, or we are going to talk next time about Lyme and how to prevent. One of the things to do, obviously, is also deep, and now there is long clothing. It's a question. Yeah, sorry.
Yeah. So throughout your stay in Aruba, you take Claritin?
Yeah, and I give the kids as well.
Yeah.
I used to give them when they were like 2 years old. And, yes.
No, I just thought it would be a lecture about taking care of the skin, like how you like clean it, how often you do certain procedures or something like that.
So I'll be happy to answer that question since you came all the way here to hear it. So why don't you ask me what specifically about the skin cleaning you want to know?
Okay, I heard that it's kind of good to clean twice a day or at least once a day, but I don't quite feel cleaning it twice a day seems too much.
So when you're saying cleaning, what do you mean by cleaning? You mean using cleansers or what?
Yeah.
Soap
like,
and water?
Not quite soap, but particularly designed for the face.
So the face. So it depends. That's a very good question. It depends on the time of the year. Depends on the body area that you use. Depends on your age and where you were, obviously. So if you have a heavy makeup, you don't want to keep it on. Actors, stuff like that, that's very important, they will wash it off. And if they have to wash it off more often, they have to wash more often. The key is if you do irritate your skin because the detergents are used to wash off. Doesn't matter how mild they are, when you repeat it again and again, you will traumatize your skin. It's important what you do afterwards, and that will be to protect the skin after you cleanse it. So one of the theories was people with very sensitive skin who have eczema, was a lot of doctors would tell them, well, you know, shower once a week, shower twice a week. I don't tell that to the patients, and I have very good results. The reason is they do need to shower as often as they want to. I recommend showering once a day. I don't recommend showering 20 times a day, but it's the way that you shower. So you don't necessarily need to use soap everywhere unless you were just in a mud tub. You know, just you're using the soap for the areas that are more sebaceous and produce the sweat, like under the armpits, groin, buttock area, under the breasts, belly button, those kind of areas you would use soap, and the rest would be enough to use water. You don't want to use a sponge or scrub it too hard, and then afterwards you don't want to dry it too much and just moisturize, and then you're basically protecting it, and then you're allowed to wash your face as often as you want. Now when you do moisturize, you have to choose the right moisturization for the right skin. So if you have an acne-prone skin, or if you have a more adult skin, you know, if it's a summer, if it's a winter, you would choose, it sounds complicated, but that's because it is. You know, it's not a cookbook that you give to everyone the same thing. And you need to check which is appropriate for you, what chemicals are there. I find that simpler stuff, even cheaper stuff, works just as well, maybe even better than the more expensive creams and lotions. Did I answer kind of your question?
Lyme disease is coming up, doctor?
Yeah, we'll do it next time. I didn't want to make this lecture too long. I just wanted to make it, you know, shorter. You have a question about Lyme you want to ask?
Well, no, my niece has, we're not sure she has Lyme disease. So
Lyme disease, my advice is if you spend time upstate, when you come back, doesn't matter what, you do blood work for Lyme disease. Yeah. Because you miss it and you're dealing with you don't know what. And we've had a lot of patients that had chronic Lyme disease, and once you get into the third stage of Lyme disease, forget it. You're chronically on antibiotics just to keep yourself not from getting worse. And we're talking about depression, we're talking about neurological side effects, unable to talk, unable to walk. It's crazy because it's already penetrated the neurological system. So sometimes I have friends, what they do is after the summer they take the tetracycline antibiotic for a month just as a prophylactic, just in case. I think just doing a blood work and repeating it in a month after the season is over is good. And obviously checking yourself and your kids and having your wife or husband check your hair everywhere, because I've seen them in the belly button. People were not undressed, they had it in the belly button, they had it you know, on their scalp. My nurse recently went with her son, and she's like, did you shower yourself? He's 8 years old. I was like, yeah, I showered, Mommy. Did you wash your hair? Yes, I washed. And she touched, and it was dry. I was like, you know what, let me take you to the shower. You didn't do a good job. And in the shower, she found something on his arm, which was the tick. And she came here, called me Saturday, and we came together and, you know, took care of that. But the point is, you need to be vigilant with those things. It was still small, and the problem is people will think it's a mole. And I remember going to the beach and playing frisbee with my son, and this lady, it was a Saturday, and this lady was like, oh, Dr. Levit, here's your frisbee. I'm like, thank you. And I'm like, oh my God. And she's like, and she asked me, you know, I wanted to come to you for the mole on my back, to remove the mole. Can you look at the mole? And I'm like, oh my God, no, you're not waiting for a month, you're going today, you're seeing someone now. Like, no, I'll finish swimming. It's like, no, you can't. And this stuff is like big, sucking so much blood, and it's hanging off her back. It's like, and nothing bothers me, I'm okay. I'm like, all right. Anyway, so you need to watch out. Unless you want to come to the beach and have me see it. Anything else? All right. Well, thank you very much, everybody, for coming. It was a pleasure to listen to your questions, and hopefully it was a little educational as well for everyone. Thank you. Any questions there?